What happens when the very title that defines trust in healthcare, the word doctor, is suddenly declared off-limits for thousands of professionals across India? Tonight, we dive into a decision that could change the future of physiotherapy, patient trust, and the way you see your healthcare provider. The Directorate General of Health Services, or DGHS, has ruled that physiotherapists are not entitled to use the prefix doctor. In a letter addressed to the Indian Medical Association, DGHS made it clear, physiotherapists are not medical doctors, and using the prefix doctor may mislead patients into believing they can diagnose and treat medical conditions beyond their expertise. As a result, DGHS has ordered the immediate removal of doctor from the newly approved competency-based curriculum for Physiotherapy 2025. It also directed that more suitable titles be considered to properly reflect the profession, without creating confusion between paramedical and medical practitioners. The decision is backed by a long line of legal precedents. In 2003, the Patna High Court ruled that physiotherapists not registered under the state medical register cannot use the title doctor. The Tamil Nadu Medical Council has also barred physiotherapists from using it, describing them as paramedics or technicians for the purpose of law. And in 2020, a Bengaluru court reaffirmed the prohibition, stating that physiotherapists and occupational therapists must operate under physician supervision and should not use the prefix independently. However, this ruling is far from one-sided. Physiotherapists across India argue that the decision discredits their advanced training and undermines their identity. They point out that their education, both at undergraduate and postgraduate levels, has been recognized under the National Commission for Allied and Healthcare Professions. For them, doctor is not just a title, but a symbol of expertise and professional recognition. Many worry that removing it will damage credibility, reduce trust from patients, and limit their role in frontline care. The debate raises urgent questions. Will this directive be enforced equally across India? Will physiotherapists take legal action to reclaim the title? And most importantly, will patients begin to lose confidence in the profession, or will they see this simply as a matter of terminology? For now, the DGHS decision is final. Physiotherapists in India are not allowed to use the prefix doctor. But the battle for recognition is far from over, and the fallout from this ruling could reshape healthcare practice in the country for years to come. So what do you think? Should physiotherapists be allowed to use the title doctor to reflect their qualifications, or is the DGHS right to draw a clear line between medical doctors and paramedical professionals? Tell us in the comments below. Share this video to spark the conversation, and don't forget to hit like and subscribe for more breaking stories that affect your health, your rights, and your future.